everyone, welcome. Just give us a minute as people trickle in and we'll get going today. Thanks everyone for joining. Let's just give it one more minute and we'll get started.
I'm going to kick this off at 2 after the hour, just to make sure we have everyone here. All right, everyone. Thank you so much for joining us for the Kentucky Licensing Opportunities webinar. We're going to be focusing on the Medical Cannabis Program and the Hemp and Cannabinoid Program. Next slide, please. I work with a law firm called Vicente LLP. We are a full-service national law firm that focuses primarily on in the cannabis and psychedelic space. We have had this focus for over a decade, and one of our specialties is helping clients get licensed in new markets, which Kentucky firmly falls under. We do have offices all over the country, and we can help you, for the whole licensing process. Next slide, please. We are joined today by one of our local counsels, Stites and Harbison, attorney Jennifer Cave, who was, importantly, she was appointed by the governor of Kentucky to the Medical Cannabis Advisory Committee. Jennifer is going to act as our local counselor, our boots on the ground, and will be helping us with any Kentucky-specific questions, any local hearings, and we look forward to getting to know you better during this process. Next slide, please. Our three panelists today will be myself, Sally Peebles. I'm licensed in Colorado, Oregon, and Florida, and I really keep an eye out over the Southeast for the firm. I'm joined by Michelle Bodian. She is one of our rock stars in our hemp and cannabinoid practice group at Vicente. And then Jennifer Cave with Stites and Harbison. Next slide. I'd like to kind of lay out what we'll be discussing today. So first, we're going to take a dive into the medical cannabis program and talk about market projections. Then we're going to look at the actual application requirements and some local considerations. Then switch over to the hemp adult use cannabinoid program, and then wrap things up and talk about some steps you can take now, how to work best with us, and some best practices for entrepreneurs to keep their eye on. We're also going to have a Q&A availability for you guys. We can save that for the end, but if we don't have enough time, feel free to drop your questions in the chat. Or at the very end of this, you will be sent a link where you can take a survey and you can register and ask any questions, and we can reach out, schedule a follow-up call, and take a deeper dive if you would like. Next slide, please. Next slide. So what has this program looked like so far? About a year ago, Kentucky bill, Senate Bill 47, was signed by the governor, and that, importantly, legalized medical cannabis in the state of Kentucky. The last 5 months, we have seen proposed regulations issued, which will be implementing that program. We saw the licensing application rules dropped a couple weeks ago, and that is what we're really going to be diving into today, what you're going to need to do for the actual application. Upcoming in July 1st to August 31st, that's going to be your 60-day application submission window. This will be for the initial round of applications to apply for a medical cannabis business license. And then tentatively, the state has set the date of October 2024 for a lottery. If there are more applications for a license type than allotted for that license type, then the state will be selecting the winners through a lottery system. Next slide, please. So we have at Vicente an in-house economist that focuses his practice on data around medical markets in the United States and internationally. He has put together these a patient growth model so our listeners can understand what will the patient growth look like over the next 3 years. This will help you plan for capital requirements when you're talking to investors and just your own planning. So but by the end of the first year, we anticipate seeing about 24,000 patients. By the end of year 2, we're looking at more than doubling that at 58,000. And then by the end of year 3, practically 90,000 patients we will see, hopefully. That's a pretty robust market. And he looked at nearby similar southern markets to come up with those numbers: Arkansas, Missouri, and Ohio. Next slide, please. So here's a broad overview of what the big do's and do nots within the program. So while the program does allow for the use of medical cannabis, it is not going to allow for home grow, meaning cultivation of medical marijuana by a patient at home. You will need to buy the medical marijuana at a dispensary. It will also not allow for the smoking of cannabis. A license cannot acquire or possess flower, raw plant material with over 35% THC. Products intended for oral consumption, like an edible or an oil or a tincture, is limited to 10 milligrams THC per serving. It cannot acquire or possess any product over 70% of THC total content, and no product can contain vitamin E acetate. That is a nod towards the issue, the vaping issue we saw a few years ago. Vitamin E acetate was the culprit there, so they're saying we won't find that in the Kentucky program. Next slide, please. So who's going to be in charge of all of this? An existing department, the Cabinet for Health and Family Services, is being tasked to be in charge of this program. They're going to be responsible for issuing the regulations that we've seen. They're going to have annual reports to the legislature, and they'll also be the one issuing the licenses. Next slide. And what business types can you even apply for? So first, they have a cultivation license type. That is where license holders can grow the marijuana. That will come in 4 flavors, tier 1, 2, 3, and 4. Only tiers 1 through 3 will be available in this initial licensing round. You can also apply for a processor license. That is when the raw plant material is extracted and you create the products, the final products, like an oil or a tincture or an edible. You'll also have dispensaries. Dispensaries is where is the brick and mortar shop where a patient would come in and purchase the medical marijuana product from the dispensary. And then you have safety compliance facilities, which is their term for a testing facility. Finally, we'll have a producer's license. That is just like the cultivation tier 4 will not be available in this initial round, but that will be a producer license will allow the holder to have both a cultivation and a processor license under one license type. Next slide, please. So the qualifying medical conditions in the state of Kentucky are pretty comprehensive. We like to see a broad range of medical conditions so that as many patients in a state can be helped by medical cannabis. Here we see notably both any type of form of cancer, regardless of stage, and very critically, we see pain. Both of those capture a large percent of those patients with ailments in any state. So a lot of patients will be helped in Kentucky. It also has some language that allows the Kentucky Center for Cannabis to later designate more medical conditions as they see fit as time goes by. Next slide, please. So card holders will include both registered qualified patients or designated caregivers. And critically, they are going to allow reciprocity, meaning a visiting qualified patient, a patient who lives in a state outside of Kentucky that has a regulated program and has their own patient card issued by their state, can travel into Kentucky and use that out-of-state registry card to purchase medical cannabis from a Kentucky dispensary. Next slide, please. Qualified patients must be 18 years of age. They must be a resident of Kentucky. They have to obtain a written certification from a medical practitioner, and they could not have been convicted of a disqualifying felony offense. If you are a visiting qualified patient, that 18-year-old threshold is raised to 21. And there is some language that allows qualified patients under 18 to access medical marijuana under the guise of a caregiver with certain limitations. It will allow designated caregivers. They must be 21, not be convicted of a disqualified felony, and they have to agree to assist no more than 3 registered qualified patients at a time. Next slide, please. So let's take a dive into the state application requirements. These are the rules that were issued a couple weeks ago, and will tell us what we need to do to get a license. So the first high-level takeaways, as I mentioned, applications will be accepted electronically. They will not be manually submitted. They will be submitted electronically from July 1st through August 31st. That's a 60-day application window. There are going to be license caps instituted on each of the license types. For example, they're only going to issue a certain amount of Tier 1 cultivation licenses and a certain amount of dispensary licenses. And to determine the winning applicants, a lottery system will be implemented. Next slide, please. So vertical integration will notably be prohibited. This means that a license holder can only apply for one license type. They cannot hold a cultivation license and a processing license. They cannot hold a dispensary license and a cultivation license. They need to focus on one license type. However, if you want to, you can apply for multiple applications for that license type, as long as each application has a separate address and can be represented by its own sufficient capital. Except for cultivations, you have to have applications can only apply for a single tier. So the takeaway there is I can apply for 3 processors if I want. However, I need to have a separate facility address for all 3 of those applications, and I have to have sufficient capital that's not overlapping for each of those. And we'll dive into the sufficient capital requirements in a bit. There is some interesting language in the Senate bill that says a priority review will be given to existing Kentucky hemp businesses in good standing. Since this is a lottery, we're not exactly sure how that is going to play out quite yet, but it most likely will be something that we see in later rounds. These are only proposed rules, so there is an ability for the department to come out with some clarification, and we have submitted a question about that. Next slide, please. So here are the license cap numbers. I won't read these out to you, but you can see that they're only going to be, for example, 10 tier 1 cultivators, 10 processors, 48 dispensaries. So if you're looking to get one of these license types, that is how many the lottery will choose in each of those classes. Again, tier 4 cultivators and producer licenses at this time are at a 0 because they are not going to be available during this initial license application period. Next slide, please. So here's that application timeline. As mentioned, from July 1st to August 31st, there's a 60-day application submission period. Those are the 60 days. At any time within the 60 days, you can submit that application. Once they get that application, they will be reviewing it. And if they find that something's missing or they would like an edit to be made, they're going to send an action letter letting you know what to fix. They will send those by September 15th. If they think your application is tip-top and it doesn't need to be amended, you'll get a no action letter letting you know that it's fit to be placed into the lottery. The applicants will have 10 days from September 15th to September 25th to fix any edits, fix any issues that they've been notified of. And then they're going to have a lottery in October. Again, that's a tentative date. Next slide, please. So here are the fees. I've been talking to a lot of interested Kentuckians, and this is probably their #1 question is, how much is this going to cost us? So when you submit your application, at the time of submission, you will be responsible for paying the non-refundable application fee. I won't read these out, but you can see that they range anywhere from for $3,000 to a tier 1 to $20,000 for a tier 3. If you are chosen for a license, you do win a license through that lottery process. Within 2 weeks of getting notified that you won that license, you will be responsible for submitting the initial licensing fee. And those fees range anywhere from $12,000 to $50,000. And then annually, once you get that license, they'll have an annual renewal fee. This is typical, something we see in every state, and those fees will range depending on license type, and as you see in the far right column. Next slide, please. And this gives an overview of the sufficient capital requirements. So the state wants to be sure, if it is going to give you a license, that you have enough capital, that you have enough money to operate this successfully. They want to make sure that they're handing these licenses to teams that do have the funding to be able to execute their business plans. They have determined that this is the amount of capital they require for each application type. So if you're applying for just one tier 2 cultivator license, you would have to show $200,000 in the bank, or some sort of through an investor note saying they'll give you the money once you get licensed, or some sort of other loan. Some sort of documentation that shows you will have $200,000 at your disposal to spend on operations for this tier 2 cultivator. On the same vein, if you're going to apply for more, let's say you're going to do 2-tier cultivator licenses, you would have to have $400,000, 200,000 times 2. That same rationale will apply throughout here. If you're getting you're trying to get one testing facility, you'd have to have 150,000 in the bank. If you're getting 2, you'd have to have 300,000. Keep in mind, this is not a fee. This is just the money you need to be able to show that you have in the bank or committed via a lender if you are indeed issued a license. Next slide, please. Now I'm going to pass things over to Jennifer, and she's going to be going over the dispensary.
Hey, Sally. Again, my name is Jennifer Cave. I'm an attorney at Stites and Harbison law firm in Louisville, Kentucky, and it's great to have you all with us this afternoon. As Sally mentioned, there are some restrictions on the number of dispensary applications dispensary licenses that will be issued during the first round of licensing. The state has designated 11 geographical regions. Applicants can only submit one application for a dispensary per region. If you want to go to the next slide, I can talk about the rest of this slide, but I think it's helpful to show the regions. So this slide shows the 11 geographical regions of the state. The Kentucky Medical Cannabis Program worked with the Kentucky Department of Transportation to divide the state into these 11 regions to ensure that no individual Kentuckian would be more than a 60-minute drive away from access to a dispensary. And so that was the idea behind putting these regions, designating the regions the way that they've been designated. The state will issue 4 dispensary licenses per region, unless a region has an urban county or consolidated local government, such as Louisville Metro or Lexington Fayette urban county government. And in those situations, there will be 6 dispensary licenses issued in each of those regions. That would be region 1 and 2. And our understanding is that 2 licenses would then be issued in Jefferson County instead of 1, and 2 licenses could be issued in Fayette County. Next slide. So now we're going to talk about the information that will be required to be submitted as part of your license application. And Sally will talk some more about this at the end. But this is where working together, we can help ensure that your business has an approved licensing application that can go into the lottery if there will be a lottery. So starting off, You'll need to include your business entity formation documents. You'll have to have a proposed location of the cannabis business, and that will require a street address. You will also have to include documentation of your site control and your site plan for your proposed facility. You will need to disclose any persons or business entities associated with your entity that will have a 10% or greater equity or similar interest, and you will need to submit an organizational chart with all of the owners and lenders identified. In addition, if any principal officers or board members have a criminal background, that will have to be disclosed. Disclosure of board members' past business issues have to be disclosed. These can include things like if a previous company was convicted, fined, censured, or had its registration or license suspended or revoked. And if applicable, you will want to include your previous work experience in the cannabis industry, including any history of suspensions, revocations, or disciplinary actions. Continuing on with the information required in the license, for each principal officer, we will need to include a description of the duties, responsibilities, and roles. And that goes to board members, employees, or other individuals or entities with a financial interest as well. We'll need to include an operational timeline showing steps and estimated time to begin licensed activities. We will need to include a financial plan for your business, including a budget and cash flow planning and debt management. And as previously discussed, we'll have to document sufficient capital available to each applicant based on the license type you're seeking to procure. Taking sort of a step back now and talking particularly about the operating plan. The operating plan that will have to be submitted as part of your license application will have to cover a number of things, and they include how you'll be handling your security, how you will be qualifying employees, supervising and training them, how you will handle transportation of your raw materials or products, how you will handle storage and labeling, inventory management, record keeping, how you'll prevent unlawful diversion, and how you'll develop the workforce and create jobs in Kentucky. Continuing on with the application requirements, we'll need to include the name, mailing address, business title, phone number, and email of the primary contact, as well as any entity or individual who assisted with preparing the application. Document any management service agreements that are in place. The application has to include a notarized signature, and the applicant will have to also attest that they will comply with all of the rules and regulatory requirements that accompany the program. Now we're going to talk a little bit about local law issues. And this can include county laws and city ordinances that may impact the ability of businesses to conduct cannabis operations. So prior to the state's issuance of a license to a cannabis business, and again, these licenses we are expected to have issued before the end of the year, a city or town or county can pass an ordinance that will prohibit all cannabis business operations within their territory. Importantly, we don't think that a local government can do this after a business license has been issued. In the alternative, a local government can enact resolutions putting the question of whether or not a cannabis business can operate within their territory to a vote at the next regular election. We think these elections, if any, will be on these votes, if any, will be on the ballot in November. And if the vote fails to pass, it cannot be placed on the ballot in that local jurisdiction for another 3 years. Next slide, please. Where cannabis operations are permitted on a local level, local governments may also enact ordinances regulating the time, place, and manner of cannabis business operations. However, these ordinances cannot be unduly burdensome. They cannot make operating a cannabis business in that county or in that town unreasonable or impractical. In addition, local governments can, by state law, establish and assess fees to compensate that local government for additional costs incurred as the result of the operation of cannabis businesses. However, those fees have to be reasonable, and they have to be in line with what the actual costs to the county or city are. Next slide, please. If you want to locate inside a county that has banned all cannabis businesses, a city located within the county can approve cannabis business operations within the city limits through the passage of an ordinance. And similarly, the city can put the question of whether cannabis businesses may operate within the city to a vote at the next regular election. Next slide. And then sort of lastly, if a city or county passes an ordinance that bans cannabis businesses, Kentucky law allows for a public petition process in order to submit the question to the affected voters. So the voters of that city or county that had banned the cannabis business. In order to put the question on the ballot, a petition has to be signed by 10% of the eligible local voters in that city or county in order to put that question on the ballot. Next slide. In addition to sort of the other things that cities or counties can do, the state law requires that cannabis businesses not be located within 1,000 feet of an existing elementary or secondary school or a daycare center. There is a GPS mapping tool available on the state's website that can sort of assist you with a preliminary assessment of whether or not a proposed location might comply with this requirement. But this requirement is significant and is a key requirement, and we urge, extreme caution in identifying the location of your proposed business. And of course, your business can't be located in a city or county that prohibits cannabis businesses outright. And with that, I will pass the presentation over to Michelle, who will discuss Kentucky's hemp program.
Hey there. Thanks for all of that, which is a lot currently happening and a lot about to happen in the state. So we just wanted to take a moment and talk about what's already been happening in the state of Kentucky, just so everyone's aware. So back last summer, we did get signed into law a new legislation, House Bill 544, which has resulted in a couple rounds of emergency regulations. And what Kentucky did, kind of predating the implementation of the medical program, is set up an adult use cannabinoid hemp program. So typically how we've seen states roll out kind of across the country, typically there's a medical program, possibly an adult use program, and then some type of adult use hemp cannabinoid program, similar to what we saw happen in Minnesota. I'd say kind of Kentucky's taken a unique approach here and flipping it, where it has started with a robust hemp cultivation side of things and then moved into a robust adult use cannabinoid program. And even their terms and definitions are a little bit different than how other states have viewed this emerging market. So a similar regulatory authority here. So it's the same Cabinet for Health and Family Services, different division though. So you got to be nagging two different people when you've got questions on the plant. And then Kentucky set it up as adult use cannabinoid and then non-intoxicating cannabinoid. And I do want to emphasize both are permitted in Kentucky. There's just a different set of rules depending on the product that you're interested in selling. So in Kentucky, these products don't need to be manufactured. They don't need to be grown in Kentucky. There's some approved source language about where the ingredients can come from, but you can manufacture an adult use cannabinoid product in Minnesota and sell it in Kentucky as long as you follow Kentucky's rules. So what does this all mean? So essentially, if the product has a ratio of non-intoxicating cannabinoids of 25:1, that would be something that can be sold more or less anywhere. And then if the product contains certain adult use cannabinoids, that product gets sorted into more of an adult use, as the name shows, an adult use model where you do then need to follow some additional rules in terms of where you can sell it. And Kentucky does have some helpful lists. You know, always what is a cannabinoid? How's everyone defining it? So in Kentucky, the adult use cannabinoids, and these are again expressly permitted, Delta 10, Delta 9, Delta 8, THCA, THCV, THCVA, Delta 6, HHC, THCP, and THCM, which I confess is not one I'm familiar with. So those are the adult use cannabinoids. Those need to be sold 21 plus. And then the non-intoxicating cannabinoid list: CBD, CBDA, CBDV, CBDVA, CBC, CBCA, CBGA, CBCA, CBG, CBN, CBT. So essentially, alphabet soup, pick your cannabinoid that you're interested in selling, again, hemp derived. And then based upon the cannabinoid formulation of where you're looking to sell, you'd have one set of rules. If you're looking to sell an adult use cannabinoid, so a Delta 8 product expressly permitted in Kentucky, you would just have additional hoops to jump through. If you're interested in selling a cannabinoid that I did not just rattle off, that would need to be approved by the cabinet before you go ahead and start manufacturing and sale. There's robust testing requirements similar to other states. This is going to be similar to a cannabis product testing, heavy metals, lead, pesticides. You're doing full testing to see what's in there, and then robust labeling and packaging. No child appearing images, logos, no cartoons, no likeness or phrases that are popular or advertised to children, no use of the word candies. Just to make sure these products are considered for an adult use audience. Next slide. Okay, and then registration. So we heard everything that's coming on the licensing front for medical marijuana. In the meantime, a retailer can register, so either a processor, manufacturer, or retailer needs to register each individual product. So that registration portal is live. You can see the hyperlink when we sent this out. In addition, retailers must register their retail store. So there's going to be both individual product registration and then retail registrations. The fee for the retail establishment is $2,000 annually. Even if you're an out-of-state online retailer, you're still going to need to register. And then one thing that they've done kind of with these revised emergency rules that we just got another draft last week, if you had done a lot of these registrations before April 27th, so before the revised emergency regs come out, they're not going to make you re-register. They're not going to make you pay the fee for the coming year. And one thing to note on all of this for the retail sales of these adult use cannabinoids, there is a setback, which is something different than how other states have viewed this. So based upon those revised emergency rules, these products cannot be sold in retail establishments located within 1,000 feet of an elementary, middle, or high school. Anyone who filled out this registration before April 27th, you're going to be grandfathered in, but any new retailers coming online, you got to check your setbacks. I assume some of this to align with the medical program and just trying to keep track of where these products are going and how they're being sold. But beyond that, take a look at those emergency rules. They are in effect. There's a public comment period on the emergency rules, and then they are also simultaneously been filed as permanent rules. And the public comment period on the permanent rules ends June 30th. So if there's anything in there you're interested in commenting on, I definitely encourage everyone to submit a public comment. The change of law from the summer was about 3 pages. The regulations are about 40 pages. So we get all the meat on the bones with those regulations. So take a look at those, but just flagging, essentially they are same cannabinoids, whether they're coming from marijuana or hemp, and then the adult use program, adult use hemp cannabinoid program kind of up and running already. All right, Sally, back to you on best practices.
Well, hello, everyone. Good to see you again. I think I have to take a moment because my phone is blowing up just to announce that the DEA has announced that they will be reclassifying marijuana from a Schedule 1 drug to a Schedule 3 drug. This is probably the most historic thing that's happened in cannabis policy in 50 years. So we can all take a celebratory moment here live on the webinar. I know that our firm will be putting on a webinar about this as soon as possible. And if you have questions about how this will affect your company, please reach out. I'm doing an inside dance right now. Very excited. But back to Kentucky and how you can get started on this and how best to work with us. Next slide, please. So I just, just 3 slides to really provide some overview of some top considerations that you should be thinking, of course. As Jennifer mentioned, property. And as with anything, the most important, it's location, location, location. If you are interested in applying, I highly recommend go out and work with a realtor. We have a referral for a great realtor we've been working with who is familiar with the setbacks. Happy to make that referral. You need to have a properly compliant location, and you do need to get some sort of possessory document, whether through a lease or a purchase agreement, or if you already own it, you'll have to show the deed. That's certainly something our firm can help you produce. Secondly, community support. You are going to be a business operating in these communities, and one of the best things you can do is get to know your city council, especially if you are hearing rumblings that the jurisdiction that you want to operate in might be considering to ban. Either way, I would approach the issue early on. Our firm is happy to help you lobby the local jurisdiction that you're talking to. We have a lot of helpful information and statistics that you can provide to them that say, hey, these are your types of businesses you really want here, and this is why. So we're happy to act as educators to the local community leaders. These communities will be putting out zoning laws. So our firm will be having a list of local jurisdictions that have who have taken steps to ban or considering. We'll be keeping a close watch on that and provide that information to our engaged clients. Third, team. I think next slide, please. I think we have a team slide. Some things to consider when you're talking to who you're going to be putting in your team. It's always nice to have someone with cannabis operational experience on your team. If not, I recommend going out to Colorado, going out to California or a nearby state where these businesses have been operating for years. People already have a lot of best practices in place. Vicente has a huge, large national network of operators, and I think there's definitely going to be people who are interested in moving to Kentucky to help out businesses there. We're happy to make those networking possibilities happen. We did that in Mississippi. We had several clients out in California who were interested in moving back home to the South, and they've been helping these businesses thrive. So happy to make those types of introductions. Government relations, as I mentioned, we're happy to act as subject matter experts and subject matter educators to not just the state lobbyists. Maybe they're considering a law in the future that might hinder your business plan, or maybe there's something in these proposed rules that you don't think is workable. We are happy to work with the state lobby, submit some comments on your behalf so we can get these rules where they need to be. Additionally, with the local lobbying, as I said, happy to provide some information that can maybe convince them not to ban. Finally, you're going to need a lot of ancillary companies to really help support your business, to notably CPAs, tax attorneys, and insurance companies. There are insurance and tax companies that are specific to cannabis that have been working with cannabis businesses for years. We have a very strong network, happy to refer you to those. I didn't go into this earlier, but if you haven't heard about 280E, you should certainly look into that. That is a IRS tax code that makes it so cannabis businesses cannot take regular business deductions outside of cost of goods sold. This can make running a dispensary or some other companies have a very high effective tax rate. So very, very important and crucial to your success that you have that you structure your company early on so that maybe you can lessen the impacts on 280E. And that's something our firm is happy to help you with and work with your CPA on. Next slide, please. Finally, financing. We've been throwing around a lot of numbers here. So I just wanted to make sure that everyone knows, generally most banks do not provide loans for these type of businesses. We are seeing some lenders pop up that are willing to loan to operating businesses, very little capital out there for non-operating business startups. There sometimes is some financing for the real estate. Usually have some higher interest rates, but that there is, you can find those types of lenders out there. Banking, our firm Vicente does have an in-house cannabis banking expert. If you have questions, maybe your local bank is considering making the jump and providing services to cannabis clients. If that's the case, we're happy to talk to that bank and tell them how they can do it. Secondly, as I mentioned, raising capital, if you need to present something to investors, we can put together a pro forma for you that talks about who you are and is basically a pitch of your company and your business plan to investors. We're happy to work on something like that for you. A financial plan is required for the application. We do have an in-house economist who will be putting those together for clients. Next slide, please. And, how can we help? We can do everything from helping you organize your business, drafting your partnership agreements, your investor agreements. If you're going to do a capital raise, we have cannabis specific corporate attorneys that have been doing this for years and can help with that. Property, as I mentioned, I have several referrals for realtors who can help you with that. We can help you buy the business or lease it. I can jump on a call with a landlord who might be a little concerned about maybe leasing to a cannabis tenant. I've been doing those types of uncomfortable conversations for years and really getting them comfortable with doing so. Compliance, once you are up in license, we can come to your facility, we can do any sort of inspections. We're there for one-off compliance questions. Our compliance team is national and is really ready to help when you need it. And then finally, expansion. Most of our clients, they start in one state and then they love it, they get the bug and they're ready to move on to the next state. We can work closely with you. We are familiar with all the states. We do licensing in any state that has marijuana licensing, and we can talk about what your specific business, how fast you want to expand, what states you want to expand into. We have such a large network of existing licensed clients. Maybe we can help you find a license to purchase in the secondary market. We really look forward to helping you get licensed in Kentucky. We're thrilled the Bluegrass State has taken this step to put in place some reasonable regulations. And please reach out and let us know how we can help. I think if you have any questions, if you just want to drop in the Q&A, Jennifer and Michelle and I will take some time now and answer them within the chat. So, because I don't think there's a way of audio taking questions, but also, as mentioned, I see a lot of questions about whether or not this will be emailed to you. A recording of this will be emailed to all registered participants. Feel free to take a look at that. And you can also send us some questions. You can schedule a call, follow up to this, and we can jump on a call and do another deep dive and talk about engagement. Thanks so much, everyone.